everybody, Dr. Z. Well, I'm about 5 weeks out from my surgery, and 1 year ago today, I actually ran that 5K hot chocolate race in Chicago that we talked about in the first video. Today, I'm going to talk about my experience in cardiac rehab, which I think is very necessary following this procedure. I like this rehab because it's a supervised situation, it's a controlled setting, and it allows me to be closely monitored with a EKG monitor and a support staff that is ACLS trained just in case something happened. The goal of the rehab is to increase my cardiovascular function, which in turn improves my activities of daily living and helps me get quality of life. Now, cardiac rehab is ideal for patients who've had a heart attack or are in heart failure or who have chest pain. It's also ideal for those who've had some sort of surgical procedure like stents, valve replacement, or coronary artery bypass surgery like I did, as well as have a pacemaker or a defibrillator placed in. Now, there's two interesting facts about cardiac rehab. One says that if you don't begin within about 30 to 45 days of your initial insult, odds are you won't join at all. And secondly, there's good evidence that says if you do a cardiac rehab program, your 5-year survival is markedly improved over those who didn't do it. So, with that in mind, please like and subscribe to my channel. Okay, hit the button below. I want to build a support network for those who have had the surgery, maybe going to go into the surgery, or just want more information about cardiovascular disease and anti-aging. You can send your questions to me at heartlyte, HEARTLYTE @gmail.com. If there's like a question that keeps coming up, we'll do a video about it. So come and join me while I'm in my cardiac rehab session. I need to get my heart going because LSU is playing Alabama. So go Tigers, and please enjoy. Here we are at cardiac rehab, week 5. And I start off with about 15 minutes on the, just walking on the treadmill. This video is about 1 year after my race in Chicago, so it's quite a milestone. It's 1 year actually to the day. I'm 5 weeks post-op and I'm feeling pretty good. I've had a fairly uneventful course. Most of my post-op problems have come around blood pressure and sleep. So we've been adjusting with my cardiologist. Some of my medications, I've weaned off the amiodarone, although amiodarone will stay in your body for several weeks to months, even after you even after you've stopped it. When my blood pressure would drop, I would have to lower some of my medications. And as we've lowered it, we sometimes have had some problems with the PVCs coming back, and it appears that the PVCs are related to my heart rate. So that's just something that we're going to work through. I have had no difficulty, no pain. Now, when my blood pressure would drop, I get a little lightheaded. Sometimes I'd have to sit down. But outside of that, nothing bad. My brain is as sharp as can be. I think I'm getting more oxygen there. The only other issue is it won't shut down. So sleep has been somewhat of a problem, and I pretty much deal with that with melatonin, and that seems to help that a lot. In discussion with my docs, I mentioned in my initial video I was on testosterone, so I could feel the weakness and
it wasn't that I was depressed. It was just, I'm not used to sitting around. So I did go ahead and have 300 milligrams of testosterone pellets replaced. I normally get 12 to 1400, so we thought that was a fairly safe dose. And within 2-3 days, my energy went up, my mood improved, I was happy, and I'm back to work. Now, when I say I'm back to work, I'm doing it very slowly, limited to just the afternoons, and only seeing a couple patients a day. I'm totally asymptomatic when my meds are adjusted, so I feel good about that. So I'm still on the treadmill, and a couple of things we need to talk about. So what happens to our bodies after surgery, where guys like me who are very active suddenly go to low activity or no activity? Some people will call that detraining. And there's a couple measurements that we do in medicine for health, and these seem to go away fairly quickly when you even take an elite athlete and put them to bed rest. And the first one is called the VO2, which is the utilization of oxygen. It's a measurement of how much oxygen you take in, goes to your tissues, and how well you use it. It normally will fall with age, and it'll fall if you're sedentary, but it falls much quickly, or very quickly, if you've been an athlete and suddenly stop. It's really interesting because those who've had a sedentary lifestyle, their VO2 doesn't drop as quick because it's already low anyway, but VO2 is an important measurement because you need oxygen, and the oxygen helps with healing. Now, not only does the VO2 drop, but our muscles deteriorate. They don't turn to fat, they just get smaller and they shrink. We sometimes call that sarcopenia. That's the medical term. It does turn to fat if you stop exercising and then just start eating, or you feel stress. But just the act of not exercising shrinks your muscles, doesn't turn it to fat. The third issue is that our mitochondria start to shrink in size and in number. And mitochondria are the power cells. They're like little batteries in each cell. So if you are not exercising, those go down. So you can see by even taking an athlete and putting them to bed and then having them have the insult of surgery, their oxygen utilization goes down, their muscles shrink, and the power packs get smaller. Hence, we go to cardiac rehab to start to rebuild that. Some of the goals of this will be to increase blood ejection from the heart, and that increases blood flow to all our vessels. Now, one of the problems is if you're overweight and out of shape, the heart has to pump blood to areas that aren't necessarily vital. So the more active you are, the better. So that's what we're working on. So we're trying to rebuild my VO2 max. We're trying to rebuild our muscle because my muscle mass, I can feel, is going way down. And we're going to work on mitochondria. There are some studies from the Cooper Clinic in Dallas and a group in California that will talk about outcomes post-surgery for those who are sedentary and were at one point fairly athletic. And they found that the sedentary group had almost a 60% chance of having higher hypertension than the group who was moving. But that once you started moving, you could drop that risk of mortality fairly significantly. So the goal of this is get moving early, get moving often. They will often use something called METS, M-E-T-S, which is a metabolic equivalent of a task. And basically what they try and look at is if you're a certain size and you have a certain workload, how effectively do you do that? And as you improve your cardiac output, you're able to do more METs. And it turns out that there's about a 10 to 20% increase in improvement of death and mortality for each MET that you're able to improve to. So with that in mind, this is 1 year from the 5K. It's a little bit about cardiac rehab, and I'm going to talk more about, we'll break this down more, and we'll talk about blood pressure, and we'll talk about oxygen, and we'll talk about how things you can do to make yourself the best you can be. So thanks for watching, and I will catch you on next time. Okay, done rehab for the day. I'm going to head to work. I hope you enjoyed this. I hope the tips are helpful. If you have questions or comments, write them down below. You can also write to me at heartlyte, HEARTLYTE @gmail.com. We will be breaking down my initial video. I know it was long, but there's a lot of information, and over the next couple of weeks we'll break down some of the points I was trying to make so they're a little more understanding, a little more helpful. Send your questions and comments to me. Let's build a community where we're all helping each other and improve our health. So Dr. Zuckerman saying have a good day, and I'll talk to y'all later.